encouraging news tonight in the fight against cancer, specifically here melanoma. Far too common, and it can be far too deadly when it's not caught in time. But a new treatment approach is getting some excellent results, we're told, and could be used to fight all kinds of different cancers. We get our report on this tonight from our chief science correspondent, Robert Mazzell.
There it is. Nicely done.
Mary Elizabeth Williams is 47. In 2010, she got a diagnosis of stage 4 melanoma that had spread to her body.
It was the beginning of the school year for my kids, and suddenly I didn't know if I was going to be there for the end of the school year.
Williams got a new kind of therapy that worked so well. In a few months, her doctor gave her the best possible news.
He told me that my cancer was completely gone, and I was so stunned and surprised.
Unlike chemotherapy, which directly kills cancer cells, immunotherapy works on white blood cells called killer T cells that devour bacteria and viruses. Cancer cells put up a chemical shield to protect against T cells. Immunotherapy breaks down that shield, and the T cells go to work. The first such drug, Yervoy, helps 10 to 15% of advanced melanoma patients.
That mass was significantly reduced.
In this latest study, doctors combined Yervoy with a second experimental drug that hits a different target on the T cells, allowing them to kill even more cancer.
I'm tremendously excited. We're actually seeing more than half of patients having significant regressions of their advanced melanoma.
How are you doing?
And it is not just melanoma. Because of similar drugs, David Gobin has seen his lung cancer disappear.
I can do a lot of things I couldn't do before.
And Ken Kirkwood's kidney cancer is gone. Many researchers believe this is the beginning of one of the most promising eras ever in cancer research, treating, even curing, significant numbers of patients in an entirely new way. Many similar experimental drugs are being tested, and other combinations could work even better. While the drugs have side effects and will be very expensive, there's no doubt they will save many lives. Robert Mazzell, NBC News, New York.
We are back in a moment with what we learned today is disappearing at one of the most famous